Hello, my name is Nicole Cox, and I'm going to be talking about IV placements in school children. The first thing I want to go over is the reason for treatment. So the reason that a school-age child might need an IV placement is 1, they need blood drawn, 2, they need medicine and they need to act quickly, and 3, they are dehydrated and they need water in their system quickly. Next, I'm going to talk about the sequence of events. So we're going to start with when the child comes in, the child life specialist is going to make them feel as comfortable as possible. They're one of the first on the scene, and they're going to try to make them feel comfortable in an uncomfortable position by just explaining, showing, letting the child ask questions, so on and so forth. When the procedure starts, the RN is going to look over the medical records and ask them questions. These questions include name, date of birth, and those questions will help them identify the patient and make sure that the patient that they're supposed to be doing the treatment to. The next thing that's going to happen is that there's going to be a re-explanation of what is going to happen and why they're getting this treatment before the child even goes into treatment. Usually the child life specialist will go over this with them before, but we like to reiterate what's going to happen to them so that we can make sure that they feel as comfortable as possible going into it. This is going to include what is going to happen and why it's going to happen. And when you're a school-age child, you can be when you're working with school-age children, you can be a little bit more in-depth and use the correct medical terms for things and use the actual names of the veins and what they are and stuff, because school-age children are wonders. They want to know, they're learners, they're in school and they're trying to learn and teach. No matter how much they like it, it's like school, that's what their brains are doing, that's what they're trying to figure out, and they like that information. So it's good to be able to explain everything fully because they know they're learning, they're wondering. The next thing is that the child is going to be asked to put their arm over to the side, rest it on the armchair or on the table next to the bed, and they are going to be asked to put it in the most comfortable position for them. Following that, the RN is going to put a band around their arm. They'll make it very tight so that the blood rushes to the area so we can find the right vein for them. What vein is going to work best for either the blood drawn, the medicine, or the water being inserted. Next, the area that the IV will be, whichever area the nurse chooses, that area will be wiped down with a alcohol pad that will clean the area. After that, the IV will be inserted and treatment will begin, whether that's getting the blood drawn, the medicine in, or the water in. That will begin then, and then the child will be asked how they're feeling, and then after that the IV will be removed. Next thing I'm going to talk about is the medical staff involved. So first and foremost, the child life specialist. As I said, they're going to be there to make them feel as comfortable as possible in a pretty uncomfortable situation for them. They're going to try to ease any fear and anxiety that they have and hopefully have them leaving feeling better than they came in. Next, we have the RN, the nurse or the registered nurse. This is the person who's going to be asking the medical questions at the beginning, like I said, and also doing the treatment. Lastly, the family members may be involved in this. They are allowed to be there. This is mom, dad, sister, brother, aunt, uncle, grandpa, whoever takes care of you. That is the person. Those are the people that could be there. Next, I'm going to talk about the sensory information that's going on during this. So this is what they're going to be feeling. So first and foremost, I'd like to talk about the band. So for the child, the band is going to feel pretty tight, and it may also be uncomfortable. The band goes about here on the bicep, and this will help the blood rush to the area. I'd explain it to the child as feeling like the arm is swelling or that the blood is rushing. Some children may feel a little bit of numbness in their fingers or towards the bottom of their hands. This sensation will vary from child to child or patient to patient. Also, when explaining this, you might explain how their veins will turn more purple or blue, and if you follow your veins down to your wrist, you can show them that there's a few veins right here that they may be able to see the same blueness. This will just help them realize that it's nothing different in your body that's happening. It's the same thing that it always looks like. It's just a little bit more prominent. Next, I like to explain the alcohol pad. The alcohol pad is a small white cloth. It is going to feel a little cold when it touches the body, and it might smell bad from patient to patient. Probably going to smell bad to the child. It's a pure alcohol pad, so you can explain it as smelling like nail polish or heavy cleaner that has that kind of heavy smell in the nose. Next, I want to talk about when the IV is inserted. So when the IV is inserted, it's going to feel like a small pinch or poke in the area. The pain is going to vary from child to child, but it will feel pretty uncomfortable at first. However, when the treatment begins, it'll feel pretty much painless, and you won't be able to feel much of what's going on, other than if you twitch a little bit, you might remember that it's there, or if you look down and obviously remember it's there, but other than that, it seemingly vanishes. When removed, you're going to have the same sensation you felt going in. So being removed, the same sensation is going to kind of come. You're still going to feel it. It's going to hurt a little bit, kind of that pinch poke feeling again. And once it's removed, it's going to be a little sore in the area. When you close your arm, it might feel a little bit more sore, and for about a day, it might feel bruised. But that's about as long as it hurts. Nextly, I'd like to explain the sequence of events in a more developmentally appropriate way. So, first, the nurse will be asking you questions so they can make sure you are who you say you are. These will include things such as your name, date of birth, so on, but nothing hard. A nurse will wipe down your arm with a small white cloth that may feel cold and may smell bad to you. This is an alcohol pad and will clean the skin before the IV is inserted. It may smell like nail polish remover to you. Your veins will begin to turn blue, but nothing serious. The nurse will tie a stretchy band around your arm. This helps bring more blood to your veins, so it shows. The vein will turn blue at this point, and the nurse knows where to insert the IV at. The blueness of your veins is just more blood. When the blood in a live body is actually blue until it hits the oxygen, and then it turns red. So the blood that you see when you get a cut is red, but the blood inside your body is blue. You can find examples of that towards the bottom of your wrist. Lastly, the nurse will insert the IV into your arm. This will feel like a small pinch or poke. This pinch or poke won't last, and it will really just feel normal. And while you're getting your treatment, it's going to feel normal, and it's not really going to hurt. Just if you don't feel comfortable with it, don't look, and you will barely know it's there. Once the treatment is done and it's removed, it might hurt a little bit again. However, it's not going to hurt for very long, and we'll put a Band-Aid right over it, and you won't be bleeding very long. Or at all. Coping techniques. So lastly, I want to talk about coping techniques. School-aged children have anxiety about their life, how their life might change when they enter the hospital. That being said, the child life specialist should explain to the child how their life will be the same after an IV. So whether that is that they get to continue playing soccer with their friends, or they can continue going to school, or stuff like that, or that even that their arm isn't going to look like that forever. Those are the type of things that we need to reassure to school-age children, because they are beginning to be more driven in the way that they see themselves and they see their surroundings. And that goes with friends, hobbies, schools. They want those to stay theirs, and they want to know that after this, they're still going to be able to do all those things. That being said, another coping technique, school-age children should get back into their usual life as soon as possible. They're becoming increasingly aware of their own lives, including, like I said, hobbies, school, friends. So the quicker that the child can get back into those after being hospitalized, the quicker they'll start to feel normal again, or normal for the moment. And that's really, normalization is a huge part of child life specialist and a huge part of coping. Lastly, while in the hospital, it's important to explain everything to them. School-age children have increasing wonder, therefore explaining everything and allowing them to ask any questions they need will allow them to cope. So make sure that you want to make sure that they know that their lives won't change, like I said. So when they ask questions about if their social life is going to change, or if whatever the circumstances, you need to make sure that you tell them that it's not going to be any different. They have increasing wonder in the way that you can explain every single piece of equipment that they want to know. Even if they don't remember it, they want to know, and you can explain those. It is developmentally appropriate to tell them those things. Since they're school age, they're wondering a bunch of things, like I said, so they're going to be asking many questions, and you want to allow them to ask those questions. Give them time to really explain everything, explain how they're feeling, so that you can get those questions out of them. If they want to know what an IV is, like the medical terms behind an IV, like how it works, or what the monitor in the back is doing. Those are all things that will help them feel more in control when they're in a very uncontrollable situation. It also includes telling them all the parts of the body, and you can be pretty specific in the way that you speak about them, but the parts of the body that are going to be involved. So whether that's the vein, when you're talking about the veins, or what part of the arm, or whatever, you can be pretty specific on what those things are. Another thing is to allow them to express their feelings. You want them to get how they're feeling out, because school-age children love to talk about themselves, and they're very self-driven. So if you can let them talk about themselves, you might be able to drag some of those feelings out that maybe they weren't even willing to open up about at the beginning, but now are. So letting them talk about themselves and control the conversation will give you the information you need to help them cope, and it will also help them cope to talk about how they're feeling and what they want to see happen going forward. And lastly, explain to them how their situation is similar to others. They are very peer driven at this age, and they're trying to make friends, they're trying to be part of groups, they're young adolescents, they're school age kids, so they want to be able to do those things, and it's important to let them.